At this moment, we are going to discuss about the major fungal diseases of fish and crustaceans. The first fungal disease is the saprolegnosis or saprolegnasis, which is caused by the Saprolegnia species, AQUA species, and Aphanomyces species. Many freshwater fish, such as the carps and goldfish, are affected. This fungal infection is characterized by formations of white cottony growth on fish eggs and on affected tissues of fish. Virtually any area on the surface of a fish may become infected, but it is usually the integuments that are involved. Gills, eyes, and olfactory pits may also become infected. Once infection is initiated, it is generally progressive and terminal. Affected fish become increasingly lethargic, tire more easily, and become less responsive to external stimuli. Loss of equilibrium often occurs shortly before death. Histopathologically, evidence of rapid destruction of epidermis with slight inflammatory response can be observed. To diagnose the disease, a microscopic examination of the cottony growth from the affected tissues will reveal the characteristic hyaline and choanocytic mycelia. A vast array of chemicals has been tested for effectiveness against these fungi in vitro. Common chemicals used as chemotherapeutics include bath treatments such as zinc-free alakite, sodium chloride, and formalin. The second disease affecting more than 30 freshwater fish species such as the snakeheads, catfish, gurami, goby, and others is the epizootic ulcerative syndrome. This is caused by the Aphanomyces invadans, which is associated with a disease outbreak together with rhabdovirus and the bacteria Aeromonas hydrophila. Other Staphylococcus organisms that may superinfect lesions include saprobic, Aphanomyces strains, Saprolegnia species, and Pythium species. Early signs observed among affected fish are first, darker discoloration and loss of appetite. Second, fish may float just below the water surface, or in some species, with the head just breaking the water surface. Lastly, occasionally, fish may be hyperactive with a very jerky movement. Ulcerative lesions can be observed throughout the body, which may vary from small areas of rosacea, occasionally on the side of the jaw or head, to larger, deep ulcerative lesions found anywhere on the body. Fish affected by the disease become lethargic, which may be inactive or comatose in later stages. Advanced stage of the disease often results in exposed head and bone tissues, visceral organs, and vertebral column. Total erosion of the tail is also common, and there is severe hydration problem. Histopathologically, massive infiltration of the muscle tissues by the fungus, which is shown in the picture, accompanied by severe tissue necrosis and minimal inflammatory response can be observed. Fungal hyphae may reach the cranium, kidney, and spinal cord. Outbreaks occur at certain times of the year and normally after flooding followed by the cool weather. To diagnose the infection, the presence of mycotic granulomas, which can spread throughout the lesions and also affect some internal organs, and of course, the isolation of Aphanomyces invadans from internal tissues can be utilized. Since EUS mostly occurs among wild fish stocks, it can be very difficult to control outbreaks within the local area. Therefore, where EUS is not endemic, the most effective means of control would be to prevent entry of any infected fish into the area. For areas where EUS is presently considered endemic, prevention programs should include eradication of the causative agent by removal of all fish from ponds, reservoirs, and water channels prior to restocking, drying out and liming of ponds, and also disinfection of contaminated equipment. Once the causative agent has been eradicated from an affected site, reintroduction should be prevented. Proper management by reducing stocking densities when EUS's prevalence is high in adjacent wild fish populations. Farming of EUS-resistant fish species such as tilapia would also be effective in preventing the occurrence of the disease. Potentially useful treatments for the causative fungus include coptrol and malachite green. The next disease is the bronchiomycosis or gill rot caused by Bronchiomyces species affecting carps, goldfish, and eels. In the course of infection, gills become pale with brownish areas due to hemorrhage and thrombosis, or grayish as a result of ischemia. Necrotic areas might slough off at a later stage, becoming a focus for saprolignant infections. As the infection persists, fungal hyphae in the gills obstruct the circulation of the blood. Necrosis and proliferation of lamellar epithelial cells and lamellar fusions may be observed. The disease can appear suddenly and often has a rapid course, with losses as high as 30 to 50% occurring in 2 to 4 days. Death is due to anoxia. Microscopic examination is used to diagnose the infection, revealing the branch and coenocytic mycelia of the pathogen within the affected gill tissues. To prevent and control the disease, various chemicals have been used to treat bronchiomycosis, including malachite green, benzalkonium chloride, copper sulfate, and sodium chloride. If an outbreak occurs, feeding of the fish should be stopped and dead fish should be removed from the ponds and buried in a lime pit. To help prevent further outbreaks, the ponds should be drained, dried out, and disinfected with quicklime. The last disease affecting freshwater fishes is the ichthyophoniasis or ichthyosporidiosis. This disease is caused by Ichthyophonus species or Ichthyosporidium species, affecting groupers, trouts, flounders, herrings, and cods. External manifestation of the disease varies from species to species, while some affected fish don't show any external sign. Erratic swimming behavior and swelling of the abdomen are sometimes observed among affected fish. Internal organs such as spleen, liver, and kidney become swollen with numerous whitish nodules up to 2 mm diameter. Nodules can also be observed in the muscle tissues of some affected fish. Infected fish lose their appetite and become lean and anemic. To diagnose, the nodules formed in the internal organs or muscles is observed under the microscope, revealing the different stages of pathogens such as the early cyst stage, developed cysts, and fungal hyphae. These are surrounded by the host's connective tissues, forming lumpy granulomas which are typical of a fungus-infected tissue. There is no known treatment of ichthyophoniasis. However, cultured fish become infected when they are fed raw trash fish contaminated with the pathogen. Therefore, contaminated trash fish should be carefully avoided to prevent outbreaks. The following diseases are the major fungal disease of crustaceans. First, we have the larval mycosis. Larval mycosis is a major fungal disease of crustaceans that is caused by Laginidium species, Pteropodium species, and Halicteros species. All Penaeus species and crabs such as the Scylla serrata are affected. This disease is characterized by sudden onset of mortalities in larval stages of shrimps and crabs. Crab eggs are also susceptible for mycotic infection. The commonly affected larval stages among shrimp species are the protozoal and mysis stages. Progressive systemic mycosis that is accompanied by little or no host inflammatory response can be observed. Infection is apparently lethal, accumulating mortality of 20 to 100% within 48 to 72 hours after onset of infection. In diagnosing the disease, microscopic examination of affected larvae will reveal extensive, non-septate, highly branched fungal mycelia throughout the body and appendages. Specialized hyphae or discharge tubes with or without terminal vesicles may be present and could be the basis for identification of the causative agent. Motile zoospores may be observed being released from the discharge tubes in the case of some species. Disinfection of contaminated larval rearing tanks and chlorination and/or filtration of the incoming water can prevent outbreaks. Different antimycotic compounds have been tested in vitro, and the recommended chemicals for therapeutic and prophylactic treatments include the following: trefolan, formalin, egg disinfection with 20 ppm detergent followed by thorough rinsing before hatching. The second fungal disease affecting crustaceans, primarily all Penaeus species, is the black gill disease or Fusarium disease. This is caused by Fusarium solani, manifesting an appearance of black spots that preceded mortalities in juvenile shrimps grown in ponds. Infection usually starts on damaged tissues such as wounds, gills damaged from chemical treatments or pollutants, and lesions resulting from other disease processes. Once infection is established, it is usually progressive with 30% remission rate. Lesions may also serve as a route of entry for other opportunistic pathogens. For the diagnosis, microscopic examination of wet mounts of infected tissues will reveal the presence of a cano-shaped macroconidia as shown in the picture. Preventive measures include the elimination of sources of Fusarium conidiophores and destruction of infected individuals. Several fungicides show promise in vitro but none proved to be effective in actual field trials. The last major fungal disease affecting crustaceans, primarily the Penaeus menodon and other Penaeus species, is the aflatoxicosis or red disease, which is caused by the aflatoxin produced by Aspergillus flavus and other Aspergillus species, which are a common contaminants of not properly stored or expired feeds. This disease is characterized by yellowish and eventually reddish discoloration of the shrimp body and appendages observed among pond-cultured shrimp juveniles. Affected animals become lethargic with weak swimming activity near pond dikes. Soft shelling can also be observed. Histopathologically, necrosis in the tubule epithelium that proceeds from the proximal portion of the tubules, the peripheral tubule tips, and the hepatopancreas can be observed. Growth will also be retarded. Affected shrimps will not survive for more than 30 seconds when collected from the feeding trays. There will also be loss of appetite. Confirmation is by chemical analysis for the presence of aflatoxin in the suspected feed or ingredient. To prevent and control the disease, avoid using moldy feed. Feeds should be properly stored for not more than 6 months in dry and well-ventilated areas to prevent or at least minimize growth of fungal contaminants.